Hello everyone. Welcome back to my YouTube channel. Today, I am going to draw your attention to a timely topic, which is none other than the new variant of coronavirus, spreading on a large scale in India, JN1. JN1 is a new subvariant of COVID-19 that has been detected in India and has raised concerns among health authorities and experts. The subvariant is a descendant of the B8.2.86 variant, which is itself a subvariant of the Omicron XBB variant. JN1 has a single mutation in the spike protein, which is the part of the virus that attaches to human cells and enables infection. The mutation, called N501Y, is also found in other variants of concern, such as Alpha, Beta, and Omicron, and is associated with increased transmissibility and reduced antibody response. The JN1 subvariant was first identified in Kerala, India, in September 2023, during a routine genomic surveillance by the Indian SARS-CoV-2 Genomic Consortium, INSACOG, a network of laboratories that monitors the genetic changes in the virus. Since then, the subvariant has been detected in several other states, such as Goa, Maharashtra, Karnataka, Tamil Nadu, and Delhi, as well as in other countries, such as the United States, the United Kingdom, Canada, and Australia. As of December 26, 2023, India has reported 69 cases of JN1, out of which 15 are active and 54 have recovered. No deaths have been attributed to the subvariant so far. The JN1 subvariant has been classified by the World Health Organization, WHO, as a variant of interest, VOI, which means that it has genetic changes that may affect its characteristics, such as transmissibility, severity, immune escape, or diagnostic detection, but it has not yet been proven to have a significant impact on public health. The WHO has assigned the subvariant the provisional name JN.1, pending further assessment and confirmation. The subvariant is also being monitored by the Indian Council of Medical Research, ICMR, the National Centre for Disease Control, NCDC, and the Ministry of Health and Family Welfare, MOHFW, which have issued advisories and guidelines to the states and union territories to enhance surveillance, testing, tracing, isolation, and treatment of the cases. The symptoms of the JN1 subvariant are similar to those of other variants of COVID-19, and they include fever, cough, sore throat, runny nose, headache, loss of taste or smell, fatigue, and muscle or joint pain. Some patients may also experience nausea, vomiting, diarrhea, or abdominal pain. The symptoms are generally mild to moderate, and most patients recover within a week. However, some patients may develop severe or critical illness, especially if they have underlying medical conditions, such as diabetes, hypertension, cardiovascular disease, chronic respiratory disease, or immunodeficiency. Severe or critical illness may manifest as shortness of breath, chest pain, confusion, drowsiness, or low blood oxygen levels, and it may require hospitalization and intensive care. The diagnosis of the JN1 subvariant is based on the clinical presentation, the epidemiological history, and the laboratory confirmation. The clinical presentation refers to the signs and symptoms of the patient, as well as their medical history and physical examination. Epidemiological history refers to the exposure and travel history of the patient, as well as their contact with confirmed or suspected cases of the subvariant. Laboratory confirmation refers to the detection of the subvariant by using molecular tests, such as reverse transcription polymerase chain reaction, RT-PCR, or genome sequencing, which can identify the specific genetic changes in the virus. However, these tests may have limitations, such as low availability, accessibility, affordability, or accuracy, and they may not be able to distinguish between the different types of subvariants or variants. Therefore, the diagnosis of the JN1 subvariant requires a combination of clinical, epidemiological, and laboratory criteria, and it should be done by qualified and trained health professionals. The treatment of the JN1 subvariant is similar to that of other variants of COVID-19, and it depends on the severity of the illness and the availability of the resources. There is no specific antiviral drug or cure for the subvariant, and the main goal of the treatment is to provide supportive and symptomatic care and to prevent complications and death. For mild cases of the subvariant, the treatment consists of home isolation, rest, hydration, and medication, such as paracetamol, which can reduce fever and pain. Aspirin and nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, should be avoided, as they can increase the risk of bleeding and worsen the illness. For moderate to severe cases of the subvariant, the treatment may require hospitalization and oxygen therapy, and it may include steroids, anticoagulants, antibiotics, or monoclonal antibodies, which can modulate the immune response, prevent clotting, treat secondary infections, or neutralize the virus. For critical cases of the subvariant, the treatment may require intensive care and mechanical ventilation, and it may include extracorporeal membrane oxygenation, ECMO, which can provide artificial oxygenation and circulation to the body. The treatment of the JN1 subvariant should be guided by the latest national and international protocols and guidelines, and it should be administered by qualified and trained health professionals. The prevention and control of the JN1 subvariant are based on the reduction of the transmission and the protection of the population. The reduction of the transmission can be achieved by implementing public health measures such as lockdowns, curfews, travel restrictions, social distancing, mask wearing, hand hygiene, and environmental sanitation, which can limit the movement and contact of people and reduce the exposure and spread of the virus. The protection of the population can be achieved by enhancing immunization and the surveillance of the subvariant. Immunization refers to the administration of the COVID-19 vaccines, which can induce an immune response and provide protection against the subvariant. Surveillance refers to the monitoring and reporting of the cases, contacts, and clusters of the subvariant, as well as the genomic sequencing and analysis of the virus, which can provide information and evidence for the assessment and response of the subvariant. The prevention and control of the JN1 subvariant require a coordinated and collaborative approach from all stakeholders, including governments, health authorities, researchers, health workers, communities, and individuals. The JN1 subvariant is a new and emerging threat that poses a challenge to the global and national efforts to contain and eliminate the COVID-19 pandemic. The subvariant has the potential to cause more infections, complications, and deaths, and to undermine the effectiveness of the vaccines and the treatments. Therefore, it is imperative to be vigilant and proactive in detecting, diagnosing, treating, preventing, and controlling the subvariant, and to be prepared and adaptable to the changing situation and scenario. The JN1 subvariant is not a cause for panic, but a call for action and caution. Finally, we have come to the end of the video. Don't forget to subscribe to my YouTube channel, give it a thumbs up and share it with your friends. And if you find this worth watching, like the video and leave a comment down below.